The number of Kenyans diagnosed with hypertension has increased compared to previous statistics of 2014.
Working together with the Ministry of Kenya and our other implementing partners, we've managed to screen currently 3.5 million people, and we have identified over 700,000 people living with high blood pressure.
The most common cardiovascular disease is a silent killer.
Hypertension is like a time bomb because you never know when it is going to explode. One thing is that hypertension, you can be walking normally and then all of a sudden your blood pressure is very high.
Hypertension is indiscriminative, with people from all walks of life diagnosed for the disease.
I was diagnosed by Dr. Kikonyo that I have hypertension in 2015.
I'm 20 years old and I've been living with hypertension since 2009 till now. By then I was 13 years old and now I'm 20, turning 21 soon. And I've been measured my blood pressure. 3 times it was consecutive high, and then I was put on treatment room so that the pressure could go down a bit.
Hypertension drugs are expensive for most patients. Sharon, a Kibera resident, is among the lucky few to access medicine in her locality.
After realizing that AMREF here through HHA, they offer affordable medication which is easily available. So I came in and I took medication here, and now my blood pressure is controlled.
She says most of her peers are not yet on medication.
I know a few friends who have hypertension and they're still in denial because they think they are too young for the disease or the condition. So it's kind of hard for them to accept and start living with the hypertension.
Hypertension is manageable if a hypertensive patient sustains a healthy lifestyle and strict adherence to medication, failure to which the pressure can escalate and cause more damage.
It leads to damage of other organs in the body.
Erastus Itabari suffered from stroke after defaulting medication.
Sasa nikameza ile nikatulia. Naye nikaachana na hizo ndawa mingi. Sasa hapo ndio nikawa siwezi kaa chini, siwezi simama, siwezi inuka.
Hypertension is caused by various predisposing factors.
What we call healthy diets are very expensive. We go for the more affordable or cheap food stuff like chapati, mandazi, chips. They are high in fat, high in calorie, and also high in sodium, salt intake.
Modern lifestyle is also a major cause of the disease. Sitting for long hours on computers and coming of more convenient modes of transport that can traverse most terrains. Children are also at risk, sitting down for long hours watching rather than engage in more active games. What's the difference between high blood pressure and hypertension?
Medically, actually, it's the same thing. It's just that hypertension is the medical term. But for high blood pressure, is like in a layman's language. Hypertension also is defined with when optimal blood pressure, which is supposed to be normal, 120 to 120/80. If it is hypertension, we call it, it will only be when it's above 140/100.
To raise awareness for hypertension to Kenyans, various stakeholders in conjunction with the Ministry of Health have come up with street screening at busy walkways.
Really reach out to the rest of the community. We have begun what we call walkway hypertension services. These are services which are located at busy locations. For example, areas where people use walk as they walk home from work. We call them busy walkways. And what we've done, we've placed health workers there to provide hypertension screening, and we found it's been a very successful intervention.
Ndio maana tunataka at least mtu afanye exercise, ukule chumvi kidogo na chumvi ipike kwa chakula, isongeze kwa meza. Sawa.
The Ministry Ministry of Health urges hypertensive patients to make use of the newly introduced National Health Insurance Fund that covers patients with chronic diseases.
At the National Hospital Insurance Fund, they are actually now paying for everybody who has been discovered with it's one of the chronic diseases, and there's a package for that. They actually pay for it, and therefore we are encouraging people to pay and to enroll as members of the NHIF. It's actually 500 shillings per month. Yes, I know it may not be as cheap as I may think, because sometimes there are people, but we also have a very easy way of paying. You don't even have to pay the 500 ago. You can pay little, and at the end of the month, you're paid 500.
Compromised quality of hypertension medicine could cause more damage to hypertensive patients if no control measures are taken.
Ethics and transparency. So it's about fighting corruption, and it's about being ethical in everything we do, anything from clinical trials to working with patients. It's very important to make sure that we strive to work against corruption, because I think the money and the funds that we have can be used in so much better places in terms of developing products and reaching patients and working with the community in a better way.
According to a report by Step Survey of 2015, 24% of Kenyans have elevated blood pressure, a contributor to the global non-communicable disease burden. Most Kenyans are living a sedentary lifestyle with little or no exercise at all. A high consumption of tobacco and alcohol products and a high intake of salt, factors that lead to hypertension. Sheila Yogo reporting for Channel 1 News in Nairobi.